not really a physics. It's not a mystery case. It's just an interesting illustration of the sense. This patient has an HCC. You can see that the, oh boy, you can see that the posterior branch of the right portal vein is expanded. And you can see that there was a lot of enhancement in this region. And you can see that there's enhancement here as well. So this is a very straightforward case of, what do you call it, of tumor-in-vein. And the reason what I wanted to show you is that just to compare, this was done, these two studies were done about 5 months apart. And you can see how that before this patient had actually a bland thrombus right there. So just a nice illustration of the differences. Although maybe some of this was already enhancing, but you can see that the tumor thrombus usually expands, right? To call something definitive tumor thrombus, you have to see definitive enhancement. So here, there's no expansion, no definite enhancement. So this one is, you can't really definitively say that it's tumor thrombus. You can see here, the part of the vein enhances like the rest of the veins. Usually tumor thrombuses, thrombi enhance, demonstrate restricted diffusion, as you can see here. Hold on. And you can see that this was not the case previously. But you have to be very careful because acute bland thrombus will show restricted diffusion, so you shouldn't just rely on restricted diffusion as a diagnosis for tumor-in-vein. That's all I got.
Cool, awesome. I had a recent case that was similar to this, and the entire portal vein had tumor-in-vein in it, and it did not demonstrate necessarily arterial enhancement and washout like an HCC, but just kind of like low-level enhancement, but definite enhancement within it. And my theory was that the hepatic artery, like the hypervascularity that HCCs usually have, cannot happen if you have portal vein thrombosis all the time because the hepatic artery is trying to help out the liver. Do you think that that's true?
I'm thinking. Maybe, but I don't know, because plenty of time you do see hypervascularity in the tumor thrombus, even when you have just tremendous, like even if the entire portal vein is out, I've seen the tumor thrombus to be hypervascular. So I don't know, but I think it has to do with multiple factors: how bad the liver is, how what other factors, what other things are happening in the liver. But maybe.
Yeah, we've had a couple of cases where we had that and we could never prove the arterial enhancement, and so we said this is most likely HCC, tumor-in-vein, et cetera. And then sometimes we've actually biopsied the tumor-in-vein. And
you don't have to, by the way, you don't have to see arterial hyperenhancement. You do have to see definite enhancement to call something tumor-in-vein. So as long as there is definite enhancement, it's fine. You don't have to see hypervascularity.
Okay, cool.
Yeah, our experience has been similar to yours, where I feel like most cases of tumor-in-vein, we don't see arterial phase hypervascularity. We just see enhancement.
Right.
Yeah, we actually, and we had, I'll bring it next time, but we had another case that was like this, and we were like, oh, this is definitely tumor-in-vein, but the AFP was normal and the patient didn't have a history of liver disease. And we ended up biopsying it, and it turned out to be all portal vein abscess, which also had enhancement in it because it was a combination of like, I don't know, abscess material. So that one, it did look different though. I'll bring it next time. And that was a good learning case for me, that, if it's expansile and looks, even if it has enhancement, it's not always tumor-in-vein.